Welcome to Module 3 on Prevention of Central Line-Associated Bloodstream Infection, CLABSI, Central Line Care and Maintenance, Part 1. At the end of this module, you will be able to understand the importance of the maintenance bundle in maintaining and caring for the central line, recognize the importance of hub disinfection and the use of a chlorhexidine bath, understand the significance of conducting daily reviews and employing the correct techniques for dressing change, as well as the administration of intravenous, IV, medication. There are a series of questions after this module designed to stimulate your thoughts. In the previous module, we learned about the insertion bundle, and now in this module, we will focus on the maintenance bundle. The maintenance bundle consists of hand hygiene before and after handling the line, accessing the dressing site by ensuring it is dry and clean, disinfecting the hubs by scrubbing the hub before use, assessing the line patency, a daily review of the line, and daily chlorhexidine bathing for patients, CHG. Firstly, hand hygiene. It's always important to know the 5 moments for hand hygiene. It is important. Cleanse your hands with soap and water or alcohol-based hand rub, ABHR, before applying gloves to do the following procedure. Access the catheter to draw blood or administer medications, dressing change, and changing the intravenous, IV, tube or devices. Always remember to repeat the step again after removing gloves. This is the correct technique to perform a hand rub using an alcohol-based hand rub, ABHR. The second aspect of the maintenance bundle is assessing dressing. When assessing the dressing, always look at the site to see if it is loose, soiled, or wet to identify a possible infection. Remember to change the transparent dressing every 7 days or the gauze every 2 days. Use only 2% chlorhexidine in 70% alcohol for dressing, and make sure to avoid touching other parts of the insertion site during dressing changes to avoid contamination. Thirdly, disinfect the port and hub. Scrubbing the hub is important because the hub is the most common source of bloodstream infections. Therefore, make sure you go for hand hygiene first, then disinfect the port and hubs before access by scrubbing the hub for 15 seconds or 30 twists and allowing it to dry. This is very important, as you can see. This is simulated, and we put some glowworm here on this hub and twisted it. And if you can imagine that the glowworm is actually the organism on the hub, patient skin flora, because the hub is exposed over time. There are many organisms on it. After 5 seconds of scrubbing, there is still some residue. 10 seconds still residue, but less. After twisting it for 15 seconds, there is no visible residue. So it is important to scrub the hub for at least 15 seconds or 30 twists. Based on the SHE guidelines, a 5-minute scrub is recommended. However, the optimal disinfectant and duration of scrubbing are not well defined. Cleaning the needleless access device or catheter hub minimizes the contamination risk and prevents CLABSI. Next, the crucial part of the maintenance bundle is the daily review. The most important thing to highlight is that when you are assessing the line, ask yourself if the line is needed. If it's no longer needed, please remove it. Always go through the line diligently and check if the dressing is clean and intact or if there are any signs and symptoms of the infection, like tenderness, erythema, swelling, purulent discharge, or fever. Bath the ICU patient with a chlorhexidine bath on a daily basis. Chlorhexidine bathing is effective in reducing levels of pathogens on the skin. It can also prevent colonization and infection with healthcare-associated pathogens and reduce dissemination to the environment by personnel. Make sure to use it according to the manufacturer's recommendation, meaning the contact time should be adequate. If it is shorter than what is recommended, then it would not be effective. Administration sets are a group of supplies that are used to infuse medications, blood, and other treatments through an IV line. Administration sets designed for use with a CVC can include spikes to access the medication or treatment, clamps, IV tubing, and adapters to attach tubing to a CVC hub or needleless connector. Recommendations on when to change administration sets vary depending on the medication or other treatment infused through the set. However, administration sets used for continuous infusions should be changed at least every 7 days, but not more frequently than every 4 days. If blood products, or fat emulsions are administered, then the IV set used for administration should be changed every 24 hours. Chemotherapy tubing after each administration and propofol at least every 6 to 12 hours or when the vial is changed. Congratulations! You have completed Part 1 of the 3rd module. Please proceed to Part 2 of the 3rd module. This module is copyrighted under University Malaya. All right reserved under Faculty of Medicine, University Malaya. No parts of this module may be reproduced, stored in a retrieval system, or transmitted, in any form or by any means, electronic, mechanical, photocopying, recording or otherwise, without the permission of publisher.